Can HPV infection lead to cancers other than cervical cancer? Imagine a tiny virus that can do more than just cause warts. Human papillomavirus, or HPV, is a common virus that can lead to several types of cancer beyond the well-known cervical cancer. While most people associate HPV with cervical health, it's important to understand that high-risk types of this virus can affect other parts of the body too. High-risk HPV types, especially HPV 16 and 18, are responsible for nearly all cervical cancers. But they also play a significant role in other cancers. For example, over 90% of anal cancers are linked to high-risk HPV, mainly HPV 16. This cancer affects the area around the anus and is more common among people with weakened immune systems or those who have certain risk factors like HIV infection or men who have sex with men. HPV is also involved in many vaginal and vulvar cancers. Studies show that up to 90% of vaginal cancers and precancerous conditions contain HPV DNA. These cancers tend to occur more often in older women and those with previous cervical cancer, smoking habits, or HIV. The virus's ability to cause cellular changes in the genital area is a key factor here. In men, HPV contributes to about 36 to 40% of penile cancers. While this cancer is less common than others, it often appears as skin changes on the penis. Men with HIV or those who have multiple sexual partners are at higher risk. And like cervical cancer, there is no routine screening test for penile cancer, but early signs include unusual growths or sores on the penis. Another important area affected by HPV is the oropharynx, which includes parts of the throat like the tonsils and the base of the tongue. HPV-related oropharyngeal cancers are increasingly common and are linked mainly to HPV 16. These cancers can cause symptoms like sore throat, difficulty swallowing, or a lump in the neck. Globally, HPV causes hundreds of thousands of cancers each year beyond the cervix. In the United States alone, thousands of cases of anal, head and neck, penile, vaginal, and vulvar cancers are linked to HPV. The virus works by integrating into host cells and causing genetic changes that can lead to cancer. But it's important to remember that most HPV infections are temporary and cleared by the immune system without causing any health problems. Prevention is key. Vaccines targeting high-risk HPV types, especially 16 and 18, can significantly reduce the risk of many of these cancers. Regular screening, like Pap smears and HPV testing, helps catch cervical changes early but is not yet standard for other HPV-related cancers. In the realm of reproductive health, HPV is a major cause of cancers in the reproductive and genital areas, but it does not cause testicular cancer. This highlights how different cancers have different causes and risk factors. In summary, HPV infection can indeed lead to a variety of cancers beyond cervical cancer, including anal, vaginal, vulvar, penile, and throat cancers. Understanding this broad impact underscores the importance of vaccination and awareness for both men and women. If you have concerns or questions about HPV or cancer risks, always consult a healthcare professional for personalized advice.